So for macronutrients, who can tell me what do we mean by macronutrients? Okay, so why are they called macro? We need them in large amounts, which means we need them in grams, not micrograms or milligrams, right? So what else can we say about macronutrients? Exactly. They are the only source for energy, while the micronutrients will help in producing energy, but they are not like promoting or giving any energy source. So I can see that you have good knowledge about the basics, and as you said that there are three main categories. They are the carbohydrates, proteins, and lipids. So let's start with the carbohydrates. The carbohydrates, it's the major source of energy. What do we mean by major source of energy? If we want to measure what are the amount of energy we eat the whole day, the percentage of carbohydrate will be providing like about 50% less or more from our total calories on that day. Carbohydrates usually is easily used by the body for energy because it's simpler than other source of energy. So the mechanism of metabolizing carbohydrate is easy. Usually 1 gram of carbohydrates will provide 4 calories. So it's not as much as the other macronutrients, I mean. Can carbohydrate be stored in the body? Can we store it in the body? Can we store it in large amounts? We can store it as fat, yes. But I mean, like, can we store carbohydrates? Yes, glycogen. So where can we store glycogen? And muscles. But usually they are not stored in large amounts. So we have like limited storage form of glycogen or carbohydrates in our body. So this is just to let you know how we calculate the energy in certain foods. I made this very easy for you. Like if we look at the nutrition fact or the nutrition labels on a packaged food that has 12 grams of carbohydrates and has 0 fat and 0 protein. So how much energy this will provide us by serving, like each serving has 12 grams. So it's just like by multiplying the grams of carbohydrates by the amount of calories. It's not, though it's not very easy as it seems, because sometimes the carbohydrates contain fibers, and the fiber can be insoluble, indigestible fiber, or like dietary fiber that can not be metabolized in our body, so they will not contribute to the energy. Okay, so we need to know if it's like pure carbohydrates and it's all digested and metabolized. Now, the classifications, as you may know, that carbohydrates can be simple and can be complex. For the simple carbohydrates, we have the mono and we have the di, the monosaccharides and the disaccharides. So the monosaccharides are those who have only one sugar molecule in the product itself. So the examples are glucose, fructose, and galactose. So let's see each one, or let's go to the other simple sugar, which is the disaccharides. They are di from the 2 molecules that are linked together. So 2 sugar molecules are examples are sucrose, lactose, and maltose. So do you know where sucrose, lactose, maltose are found? Let's start with the sucrose. Table sugar. Okay, the table sugar is called sucrose, and the fructose, the lactose is the dairy products, and the maltose is the we're gonna see now. Now, the complex sugar are the polysaccharides. What do we mean by poly? Means that it's a lot of sugar molecules linked together to perform or to make the long chains of starch. So usually maybe they are glycogen, starch, or fiber. So our main focus on starch, because the starch and the fiber, of course, but the glycogen, we don't really see it in the food. Like glycogen, we don't take it in the food. We have it in our body as source of energy storage. So let's go first to the simple sugar, and we'll talk about glucose. We know that glucose is the main or most common simple sugar found in our body, and also found in each sugar we take from the food. Like it's the molecule that is linked to another molecule in this disaccharides, and also is the molecule that is only found for the starch. Now, the glucose serves as an essential energy source for all the body's activities. We know that our body and our cells rely primarily on glucose for energy. Now, in special cells like brain cells and red blood cells are also highly dependable on these regular, predictable supply of glucose in the blood. And they have like certain mechanisms to keep this blood sugar level always above a certain level, like above 3.5 millimoles or above like 65 milligrams per liter per day. Now, the fructose is the fruit sugar. It's also simple sugar. It's only one molecule. It has same chemical formula, but it has a somehow different chemical structure. And this difference in the chemical structure will make it more sweeter. So the sweetness of fructose is more than the sweetness of glucose. And that's why it's sometimes it's added and it's used as high fructose corn syrup. And I'm going to talk about the high fructose corn syrup in the later slides. Now, fructose, we can find it in fruits, we can find it in fruit juice, in honey, and in high fructose corn syrup. And then we have the last simple sugar is the galactose, which is produced. Usually we don't see galactose in nature because it's found in the lactose. It's part of glucose and lactose. It's part of the lactose sugar in the milk. So it's produced by the hydrolysis of the breast milk or any dairy that provide the glucose and galactose. Now, what are the differences between sugar and the glucose? A lot of people are mixed or are confused when we speak about glucose and when we speak about sugar. They think that glucose and sugar are the same. Well, glucose comes under the category of simple sugar. So sugar is the main umbrella, and under the umbrella we have the simple sugar, we have the complex carbohydrates, we have the simple and the simple and the mono and the disaccharides. So sugar includes everything, right? But the glucose is the most abundant, naturally occurring simple sugar among the other sugar. So this is the main difference between glucose and sugar. Now, carbohydrates, the second classification is the disaccharides. The disaccharides, we will start with the maltose. The maltose, as you may know, that it's also sometimes found in sugar cane, in some fruits, in grains, but also it's produced when starch is broken down. Because as I don't know if you heard me saying that starch is only glucose molecules strung together with the link. So when it's broken down, the starch is broken down, we get the maltose. And we have the second one is sucrose, fructose and glucose. Do you have any questions so far? Am I very fast? Okay. So sucrose is the combination of fructose and glucose, and this makes the table sugar. So if anyone asks you what is the table sugar, it's made of sucrose, which is fructose and glucose together. also the lactose, I'm sorry, I said maltose from sugarcane. No, I meant sucrose. Maltose comes sometimes naturally in grains, and grains because it has starch, and also it can have some amount of maltose. But the sucrose comes from sugarcane, which we make the table sugar. Now, the lactose is the galactose and glucose, as I mentioned earlier. Now, let's talk about high fructose corn syrup. I don't know if you're familiar with that. Can someone tell me about it? Do you know if it's like abundant in our consumption of foods and drinks? It is abundant. Does it have any health implications? Is it like healthful or is it unhealthy? Why? Increases obesity. Yeah, it can really increases obesity. So when we say high fructose corn syrup, do you think the percentage of fructose, like, is it all fructose or it does have glucose in it? Some glucose in it. Okay, but the percentage of fructose is higher, right? So that's very, very good, mashallah. You have good information. So how they make this high fructose corn syrup? We know that the corn syrup, the corn syrup that made from the corn, because corn has a lot of starch, right? And they do like corn syrup, and this corn syrup has a lot of glucose because the corn is starch, and the starch is mainly glucose. It doesn't have anything to do with fructose, right? So what they do is they take this corn syrup and take the glucose that is found in the corn syrup, and they treat it with enzymes to alter the structure of this corn syrup or the glucose and turn it into sweeter taste of fructose. So they want to have like a sweeter syrup. So they turn some of the glucose in the corn syrup into fructose. Why? Because we spoke earlier that the fructose is having a more sweeter taste than glucose because of the chemical structure. And usually they add it because they, it's like maybe like has a more economic revenue for them because it gives them a lot like of sweeter without using a lot of, like a high amount. So they add it as a sweetener in all the drinks we drink, like the soft drinks and some flavored drinks. Now, as you mentioned that it doesn't have like 100% fructose, it still has glucose, but it has a higher percentage of fructose compared to glucose. So some of them has like 55%, some higher, but usually like this is the average of percentage of fructose compared to glucose, 55 to 45. Now, what is the effect of high fructose corn syrup on our body? The metabolism of fructose. We need to understand first the metabolism of fructose in our body. Fructose differs from other simple sugars because fructose is usually metabolized in the liver. So when it's metabolized in the liver in larger amounts, in amounts that are unexpected, usually they have like accumulation. You know that when we have like a lot of fructose or a lot of sugar in general in our body that we're not going to use, usually the liver will turn them into triglycerides. So what happens is that as your friend said, that the obesity starts to occur, the type 2 diabetes, metabolic syndrome, high triglycerides level, also hypertension, incidence of heart diseases, a lot of health complications will arise from the high consumption of high fructose corn syrup and in sugar in general, but high fructose corn syrup because also of the metabolism that involves the liver. Now, I would like to speak a little bit about some genetic defects that happens to the babies while they're like when they are born. They discovered that they have some genetic defects in carbohydrate metabolism. Actually, we have like a special department in our hospital for the metabolic diseases and metabolic defects, medicine, and also dietitians that deal with these patients from from birth, because these patients will not be able to have regular food. Of course, depends on their defect, genetic defect involving either carbohydrates or proteins or fat. But for the sake of just not having a lot of information to study for you, I will just speak about the metabolism of the carbohydrates only. But we have also in fat, and very complicated, and they deal with it very carefully, and they need to measure everything in grams and milligrams, and restrict a lot of food for these babies, and as they grow, they usually have like regular visits to the dietitian and also to the doctor, of course. So one of the hereditary defect is the hereditary fructose intolerance. And as you may understand, that the hereditary fructose intolerance means that patients will not be able to absorb the fructose from the small intestine, and they have like some dysfunction in their enzymes and in their body to not be able to absorb the fructose, or not to be able to divert the fructose into glucose. And then they will have management of dietary management of like eliminating fructose from the food, or maybe like decreasing to some extent to what they can tolerate. So usually they give them other sources of sugar, like glucose, like maltose, or other sugars. And we always tell the patients, or that the mother first, to read the food labels to know exactly what their children are, or her child is eating or is consuming from the packaged food, just to make sure not having any fructose in this food. Of course, having like food diary and symptoms will help also, because sometimes, like even when they eat, they have like mild symptoms, and sometimes they can tolerate mild or small amounts of fructose. The other one is galactosemia. It involves the deficiency of this hormone, enzyme, which is called galactose 1-phosphate uridyl transferase, or known as GALT. And the GALT deficiency is most common cause of the galactosemia in newborn infants. And of course, the management will be lifelong restriction or elimination of dietary galactose. And we know that galactose is part of lactose. So that means that these babies are not allowed to have their mother's milk. So this baby will not be able to have their mother's milk or any regular formula, because this will affect their actually growth, and affect their also brain growth and bone development. So in order for them to grow regularly and normally, they need to take like either enzymes, or either like, I'm not going to talk a lot about the treatment, but usually for us in our department, we give them food that has lactose and galactose free, and replace their milk and milk products with soy-based products. Now, the glucose galactose intolerance is another defect, inherited metabolic disorder, and it's characterized by inability to transport and absorb not only galactose, but also glucose. And this is more challenging for us now to know what to give the baby. We usually, the baby will manifest severe diarrhea, hyperosmolar dehydration, malnutrition, because of the inability to absorb and to metabolize these sugars. So these infants should avoid the ingestion of glucose and galactose, as well as sugars containing them, for example, lactose and sucrose. So usually we give them fructose-based formulas. So this is now the opposite of the first disorder that we've seen. And as they get older, they may tolerate some of the, some of the amount of or grams of glucose and galactose better. Now let's move to the complex carbohydrates, which we know that it's the starch. So first, of course, we know that the glycogen is the form of complex carbohydrates in our body. Like glycogen, it's the animal form of carbohydrate storage. But the starch is the plant form from the carbohydrate storage, and the main or the most, known form of starch is the amylose and the amylopectin. Now, the amylose is the linear, usually polymer of glucose, and the amylopectin is a highly branched polymer of glucose. Depends on the plant, we see like a mixture of them. Like every time we look at the plant, we see some of them, some of the starch in the plant is amylose, and some of them is amylopectin. Now, we have something called modified starch. What do we mean by modified starch? Modified starch, the ones that are like they undergo one or more chemical or physical modifications. Like this can be in factories, which allow them to function properly under, like during cookings, like under high heat, low heat, for food processing. Now, the resistant starch is different, or another type of starch, which is called resistant starch, and we also refer to as dietary fiber. Why do we say resistant starch? Because it escapes the normal digestion. Like our GI tract doesn't have some of the enzymes needed to digest this type of starch or this type of fiber. Thus they're called resistant starch. So do we need this resistant starch? Do we need to eat it? Do we need to consume it? Yes, actually, the resistant starch has very important health promotion properties. Why? Because when we ingest this resistant starch, and this starch are like moving through the GI tract without any digestion or any modification. So when they arrive to the large intestine, which is the colon, basically, they will start to serve as prebiotics for the bacteria, for the normal flora we have in our guts. So the bacteria starts to ferment on these resistant starch, and after fermentation, they produce something called butyrate. And this butyrate is having acidic medium, will increase, like is an acid, like having a low pH. So it will contribute to the acidity in the, like making like acid medium in the gut, and this will prevent from some cancers. Also will promote the absorption of some minerals such as iron and calcium, and also the availability of this resistant starch for some like diabetic patients, for some patients who have constipation. Also will help them because of the presence of this fiber in them, and also will decrease the cholesterol level in people who are at risk of hypercholesterolemia, and may prevent the formation of gallstones. Also because the starch usually, especially the dietary fiber, will absorb some of the bile acids and will let it out of our body, so it will not be reabsorbed again, and it will decrease the formation of gallstones. So again, dietary fiber are non-starch polysaccharides. So what do we mean by non-starch? They will not provide or contribute to any energy, okay? Because they will escape the digestion. They will not yield any calories while digested or while ingested, and they have a significant beneficial impact on human physiological function in the GI tract and in reducing the risk of certain disease states. So what are the types of dietary fiber? Any question? Okay. Some of you are very sleepy. They are actually sleeping. Type. we have like soluble fibers and we have the insoluble fibers. As we name them, soluble fibers means that they dissolve in water. They are soluble. They dissolve in the water and forming viscous material. And this viscous material are easily digested by the bacteria in our gut, and they are fermentable, like digested like fermentable, and they are found in many foods like oats. Oats means in Arabic, shofan, barley. Sorry, maybe I wrote it wrong. Barley is without E, I think. Barley is الشعير, and legumes is the البقوليات اللي هي العدس والحمص والcitrus fruits. Now, associated with protecting against heart disease. Why? When they are like fermentable, they as we said that they can be protective against cancer, and also the presence of them will absorb extra sugar and extra fat and extra cholesterol, so they will prevent heart disease, diabetes, by lowering blood glucose and blood cholesterol. Now, the insoluble fibers means that they are less soluble, means that they don't dissolve in water. And these fibers, يعني the best example to give you is the bran, النخالة, اللي هي القشرة الخارجية حقت القمحة اللي ما حتدوب أبدا، صح؟ أنتوا أكيد شايفين النخالة، فهي ما حتدوب بالمي، ولكن the presence of insoluble fiber, of course, it will not be fermentable, but it will give like a bulk for the fecal material, and it will help in alleviating constipation with people with like chronic constipation. We can give them these fibers, like we tell them always to choose whole wheat bread, whole grains, some fruits and vegetables in order for them to alleviate the constipation and promote bowel motion. Now we have the special types of fiber, which is called the functional fibers. And these functional fibers are like, basically they are the pharmaceutical form of fibers. They are treated and like isolated from the plants, and then they are made like supplements, like as we see in the pharmacies now, and sometimes also provided to patients in the hospitals, like tablets, like some liquids, some tablets, some powders, some capsules. So these are the functional fibers, and they are mainly used for constipation, but also can be used for lowering cholesterol level and sugar. Now, the health effects of starch and fiber, just to summarize, high carbohydrate diet rich in whole grains will or may protect against heart disease and stroke. You can tell me how, if you are awake. Exactly. Play a role in reducing the risk of type 2 diabetes, and especially, lowering the glucose. And also the fiber has, like when we consume the fiber, we actually slow down the digestion process and also the absorption of sugar inside the small intestine into the blood. So the fiber itself will not have the spike, of blood sugar level after ingesting the meal. Like according to studies, when we ingest a meal that has refined carbohydrates and have a meal with complex carbohydrates with fiber, the blood sugar level will be not the same, although it's the same, like amount of or gram of carbohydrates. But the presence of fiber will delay the blood sugar elevation and make it like more stable. Enhances the health of large intestine. How? By the bacteria, yes, and of course protecting against the colon cancer because of the butyrate and the acidic medium. Helps to maintain healthy body weight by also, when we eat like more fiber, we are not actually contributing a lot to energy intake. Like when we eat, for example, a salad bowl that has like a little bit of olive oil, just like small spoon, and the rest are just like fibers from vegetables and green leafy vegetables that are not that are very low in carbs. So they will give us a lot of satiety At the same time, they will not contribute to the calories content. Also, despite fiber's benefit to health, they have drawbacks. Do you know why? What is the drawbacks of eating fiber? Gases, exactly. So the fermentation itself will cause gases and bloating and sometimes like colic. So we see this a lot, and patients who are not used to having fiber in their diet, and then when we start to introduce the fiber, we have to introduce it very slowly and gradually. Otherwise, they will develop gases and bloating and abdominal pain. I see this in patients on tube feeding in the hospital. While these patients are like on semi-elemental formula, they are not taking any fiber in the formula for like months. And then when we start to shift them to regular formula having fiber in it, they start developing this because all of a sudden we introduce the fiber in their feeding. So we need to introduce it very, very slowly. And this is also true for other people who are like eating orally, and when they like all of a sudden they started to take the fiber, and then they develop high amount of gases. And I'm sure Ms. Dima will talk to you about the GI complications such as Crohn's and ulcerative colitis, because these also diseases are always affected by the content of fiber in the diet. So usually these and especially during the crisis, during the flare-ups of this disease, usually we don't give them fiber. We give them fiber-free diet. Now, what are the recommended intake of fiber? So, although fiber are very beneficial, but we need to have a limit, because like having too much fiber is not really, recommended because of the side effects. So usually we need to have like between 20 to 35. Upper limit is 40. Okay, so it's only, you don't need to know FDA said that or the American Dietetic Association said that. You don't need to memorize, but you need to memorize the amount of fiber. Usually the recommendation is for each 1,000 calories, you need like 14 grams. So for each 1,000 calories of your diet, you need 14 grams. So if you are eating like 2,000 calories, you need 28 grams. This is the recommendation. If you go a little bit higher, it's fine. If you go a little bit lower, it's fine according to your, symptoms. But usually the WHO recommends an upper limit, which is like this is the maximum you can go with. So what are the examples for high fiber foods? We have like certain, usually fibers come from plants. And basically they come from plants. We don't see fibers in the animal foods because they don't have, like fiber in their meat and in their products. So usually like if you are eating like baked potatoes with the skin, you will get 5 grams of fibers. If you are eating like cereals, and especially if it's fortified with fibers, or if it's like made from whole grains, also will be high in fibers. If you're having like lentil soup, you'll have like 14 grams of fibers. If you're having like popcorn, oranges, oatmeal, a lot of food have fibers. But as you can see, it's always plant sources. So who can tell me, for you, for example, how many fruits and vegetables do you eat per day? Only a bowl of salad. And 1 banana? Okay. Who else? Who doesn't eat any fruits and vegetables through the day? You? So now maybe you understand why it's very important, right? It is important because if you're not eating any fruits and vegetables, because they are very easy, to consume fiber through. Of course, you may be taking fiber from like legumes and whole grains and so on, but also fruits and vegetables, we're going to see later also the content of them, and especially when we take the next lecture, which is the vitamins, that most of the vitamins and minerals are also found in fruits and vegetables. Now, we have something called resistant starch. As I said, resistant starch is the same fiber that I'm talking about, okay? The resistant starch is very similar to dietary fiber, but they have like certain names for resistant starch for certain products, like they are very high in resistant starch. And what we mean by them is that they escape digestion. They, like our GI tract will not be able to digest these starch. And these starches are like, for example, raw potato starch. Some of them, like they use it, they sprinkle it on the food. Green bananas, sometimes, you know, you buy green banana and you eat it, it doesn't taste sweet, right? It's sweet, it tastes very unripe, and still, you know, like it doesn't have a pleasant taste. But sometimes, you know, they tell you to eat it once in a while, because it has a good resistant starch that promote health and promote, you know, health benefits for your GI and for your body. So these are the examples of resistant starch. Now, the recommendation for carbohydrates, as for the dietary reference intake and also the dietary guidelines that are updated in 2020, 2025, they still have the same guidelines. They didn't change anything, actually. They have 45 to 65% of total carbohydrate, the daily calories coming from starch. So when we say coming from, no, sorry, not coming from starch, coming from carbohydrate. When we say coming from carbohydrates, do we mean only bread, rice, pasta, or we mean like all the food that contains carbohydrates, right? So people usually think that when we eat like at least half of our food should come from carbohydrate, they focus mainly on rice, and especially the Saudi population. They like to have, like, whenever I ask the patient, what do you have for lunch? Kabsa. They don't say meat, they don't say salad, they don't say, and when I ask them, do you eat meat? Yes, yes, beside. Do you eat vegetables? Yes, yes, we have like marag, we have some vegetables, but the main focus is rice. And when we look at their plate, it's full of rice. And even when we order rice from outside, like from mutabikh, they bring like a rice and chicken on top of it, right? So they focus more on carbohydrate, which is the simple carbohydrate, which is the rice that is not having any fiber in it. So here, this is the, you know, like the main recommendation we always tell the patients, that if you want to eat carbohydrate, the carbohydrate should come from nutrient-dense foods such as beans, which are like fasulia, adas, hummus, fool, whole grains like whole wheat bread, brown rice, brown pasta, fruits and vegetables. So all of this are included in the 45 to 65% of our intake. Now, we should limit refined carbohydrates and added sugar. As I mentioned, like humans consume half of their sugar from natural sources, as we said, and of course, the carbohydrate also, I missed here something. I missed here the milk, because also the milk has lactose. You know, 1 cup of milk has 12 grams of sugar. Who can tell that the milk has sugar, even if you're drinking the milk without sugar added? So milk has sugar, has 12 grams. 1 cup of milk has 12 grams of sugar. So the sources of carbohydrate could be coming from milk, could be coming from fruits, vegetables, and grains. But the other half, usually people do, is that they the consumption is from the refined or added sugar that comes from soft drinks, all the sweets that are abundant, mashallah, every day, through the ordering apps. We order like cookies, we order ice cream, we order candies, we order cinnamon rolls, we order cakes, we order you know, a lot of food that is, we are not realizing how much sugar we are taking through the day. So what are the recommendations? Do we have recommendation for sugar intake? Yes, of course we have. Limiting added sugar to less than 10% of calories per day for age 2 and older. So just think about the children you have in your family. Think about the amount of candies they eat, the amount of sugar they consume throughout the day, and which actually is replacing the nutritional food or the nutritional high nutrition value other foods that they need, because once they eat the sugar, they won't be able to eat their meals. So it's very important to have only less than 10% of the total calories. So if you say that I'm not consuming any sugar because I know that I don't add sugar to my tea or coffee, well, you better just check some of the food that you eat every day. For example, ketchup, for example, the sauces that you add to the food, the soft drinks, the cakes, all the candies, all the soft drinks. So all of these have sugar in them. And just realize how much sugar is found in each servings. Now, we know that too much sugar is not recommended. Why? Because it has a lot of disadvantage. It first contributes to nutrient deficiencies, as I mentioned, for the children and growing like children and adolescents who are in need of other essential nutrients. Also will develop dental caries. A lot of kids will develop dental caries from childhood, very early childhood, because of eating sugar and also drinking juices high in sugar. Raising the risk of weight gain and type 2 diabetes is well recognized nowadays. And the American Heart Association issued new recommendation for added sugar, which is, I don't really agree with it, but when they say it's for the men, 9 teaspoons, which means like you don't exactly take 9 teaspoons, but these 9 teaspoons could be like from the food that you are eating and having hidden sugar in them. A total of 36, because the teaspoon has 4 to 5 grams. So the total of 36 grams of sugar, which equals to 150 calories for men, and for women, not more than 6 teaspoons, which is equal to 25 grams, which is equal to 100 calories of sugar. Okay, now alternatives to sugar. We know that we advise always the diabetics to have sugar substitute, such as Splenda or aspartame, or all these commercially found in the market. Now the non-nutritive sweeteners, we say non-nutritive. Why? Because it doesn't contribute to any of the energy we take. Like when we take, let's say we are going to take like 10 sachets of this sugar substitute, nothing will be added to our energy. Like it will not increase our energy intake because it will pass through our body and metabolize. It will just give us the sweet flavor. Now, the WHO advises not to use this substitute, like sugar substitute, for weight control. Like a lot of people think that when they eat, for example, anything that has sugar-free, like added sweeteners in them, they will not gain weight because they are having like diet, something diet. If you go to the diet aisle in the supermarket and you see a lot of products that are advertised as like diet, you have to know what do they mean by diet. Do they mean like they are low in fat, they low in sugar, sugar-free? Okay, sugar-free. Let's focus on sugar-free now. So sugar-free means that and yet when we eat it, it tastes like sugar, right? So they tend to eat more from this because thinking that they are not eating sugar, so they are okay. But again, they might have fat, they might have more energy than just regular products that they can eat. And also, like according to the systemic review that they made and they found that the available evidence suggests that the non-sugar substitute or non-sugar sweeteners does not confer any long-term benefits in reducing body weight or body fat or weight control in adults and children. Of course, the exception is for diabetics, because diabetics, we need them not to have any sugar. We need them to use this for their tea and coffee, especially if they cannot, they cannot drink their tea or coffee without any sweet taste in it. So we tell them to use this. But people need to consider that this is the solution. We always need to, educate the patient. We need to tell him that it's better for you not to use this. Just to rely on, having your beverages without any sugar added. and try to rely on like not added sugar. Like, what do we mean by added sugar? Can someone tell me what do you mean by added sugar? Okay, this is easy. Added sugar, no added sugar. Okay, added to the drinks. But when we say no added sugar, like for example, I would like to stay 1 week having no added sugar diet. What do I mean? I mean that I will not be able to eat any food prepared with sugar. You know, added sugar means that you add the sugar while preparing or like cooking the food. Like you'll not be able to have the cereals, even if it's sugar-free, for example. Sugar-free cereals have sugar in them. Check them. Go today and go to the cornflakes package and read. You will see that it has sugar, even though they say no added sugar, but it has sugar, or low in sugar or something like that. It has sugar. Biscuits, sweets, ice cream, all the cakes, donuts, drinks. So we have a lot of sugar added while processing the food. This is what we mean by no added sugar. So try to make it, like challenge yourself not to have any added sugar in your diet for like 1 day or for 1 week. For those who are interested, of course, yani. But just to let you know, and to open your mind, and to know or understand what do we mean by added sugar, okay? So when we say no added sugar, and the same is true for added salt. No added salt means that like salt-free, nothing, no added salt. But the added salt, we use it more in the no added salt at the table, like sometimes salt is added. We will go to this later. Now we have something called sugar replacers. Sugar replacers is the sugar that, can contribute to energy. Like, for example, we need to be fast. This is like called sugar alcohols. What do we mean by sugar alcohols? It's a chemicals, found in like any name that end with all. It has like some nutritive sweeteners, but they are not fully metabolized in the body like the other sugar, but they can contribute to energy. And in the mouth, they will not be broken. So they will not develop or contribute to dental caries. So therefore, we find them a lot in the chewing gums. A lot of sweeteners found in chewing gums that are sugar-free gums are made with the sugar alcohol. If you want to go and check, you will find like could be like sorbitol, could be xylitol, could be any of them. Now absorption is slower, but they will actually contribute to energy, but in little amount, and they will not evoke low. They will evoke low glycemic. They will not contribute to high glycemic response. And there are side effects because some of them will stay in the gut, so they will also promote gas and discomfort. Now we'll move to the next macronutrient, which is the fat and lipids. Any question about carbohydrates? Is it simple? It's clear? Okay. Now, fats and lipids also constitute approximately 30% of our daily requirements or total daily calories intake. The gram of fat will yield 9 kilocalories. So, of course, it's like much higher than the carbohydrates. Now, unlike carbohydrates, fat can be stored in our body as adipose tissues, right? And this adipose tissue will be as a reserve for us to give us can be able to survive without food for weeks or even months. We have classification of fats. We have the triglycerides, we have the phospholipids, and we have the steroids. Now, the triglycerides are actually, most of the lipids are triglycerides, like 95% of the lipids. And also the food supply we have is mostly triglycerides. Now, every triglycerides, what is it made from? It's made of glycerol molecule, and it's attached to 3 different fatty acids. What do we mean by different? It means that because we're going to see now the the characteristics of each fatty acid. Like, you know, the majority of fatty acids in this triglycerides will dictate the characteristics of this fat, like either if it's beneficial or unbeneficial, or maybe like saturated or unsaturated, and so on. Now, fatty acids are unbranched chain of carbon atoms classified according to different type of classification. We can classify fatty acids into a number of carbon atoms, either to be like short, little, like 6 carbon atoms only, medium, between 6 to 16 or 12, and long, between 14 to 24. So this is one of the classification method. The other classification is the number of double bond. The fatty acids sometimes have double bonds in them, and sometimes doesn't have double bonds. So this is also will tell us how to classify them, either saturated or unsaturated. Saturated if it's no double bond. Unsaturated means they have double bond. Now, the position of the double bond in the chain also has a degree to classify the fatty acid. Now, let's see how they look. As you can see here, the saturated fatty acids are all saturated with hydrogen. So all the carbon atoms are all saturated with hydrogen. No more double bonds, no more hydrogen can be added. While the unsaturated fatty acids, there are a few of double bonds available that can be hydrogenated with hydrogen. Have you ever heard of hydrogenation? Okay. So this hydrogenation can happen sometimes in the factories or in the labs. Now let's see what are the most or the most special fatty acids to our health and in nutrition. We have the according to the presence of double bond, we have 0 double bonds means saturated, and this is available in most animal fats. So as a rule, most animal fats, except fish or marine sources, have no double bonds, have saturated fats. Okay, so all the animal products except fish have no double bonds and have saturated fats. Now, monounsaturated fatty acids means that only one double bond is available. Mono means one. So monounsaturated fatty acids, and we say it for short, you read it a lot in the references as MUFA, and this is available in the olive oil, and very similar to olive oil is canola oil. Now, having two double bonds means that it is polyunsaturated, and also 3, and some of them are found in like vegetable oils like sunflower, safflower, corn oil, the oils that we use in cooking, and also the soybean, flax seeds, nuts, seeds and nuts are also high in unsaturated fatty acids. Now, the second classification, remember we say the degree of unsaturation. So the degree of unsaturation influences the firmness of the fat at room temperature. So whenever the fat is saturated, it will stay solid at room temperature. Whenever it is unsaturated, it will stay liquid at room temperature. So this is just the main difference in terms of the firmness. And it influences also the stability. Now, what do you think? Which is more stable? Is it the saturated or unsaturated? The saturated is more stable. Why? Because there is no more reaction going. All the links between the carbon atoms are hydrogenated, like the carbon atoms are hydrogenated, no more double bonds, no more reaction, no more hydrogenation can happen. So therefore, they are stable. And the double bonds, they are more unstable. So when they are more unstable, they spoil faster. So that's why when we look at for example, I'm sure you've tasted one day like a nut that has been stored in an unhealthy way, and they tasted like rancid. They have like a very bad taste and very bad smell. like for example, walnut or peanuts or any seeds also that you taste and you find like it doesn't taste good. It has a very unpleasant flavor or taste or flavor. So this is called rancidity. Why? Because when we live like in a certain conditions, like there are certain conditions that we need to always preserve the fatty food, like for example nuts and cereals and seeds. Sometimes when they are not very well closed and they are like more prone to the air, they give this unpleasant smell and taste, and they become rancid. What do we mean by, and this is called oxidative damage, oxidative rancidity. And this, during this process of oxidative rancidity, the oxygen molecule, because they are not like in airtight packaging, and they're not away from light, and they're not away from the air, and maybe sometimes the temperature is not good, so they are not preserved well. So the damage to the natural structure of this oil will happen. And this will be affecting not only the odor and the taste, but also affecting the safety of consumption. So whenever you suspect that the nuts or the seeds or any oil that has a very unpleasant smell or taste, this means that it is not good for human consumption. Now, the location of double bond in the chain. Now, this is the very important to nutrition part to speak about the nutrition or the fat, because the position of double bond nearest to the methyl group end is described by omega number. And this is, I'm sure you've heard about omega-3 and omega-6 fatty acids, and these actually classified according to the presence of double bonds that is next to the methyl group. Let's see how we know. This is the methyl group, the end of the which is called the CH3, because there is C here, and C is having like four hands. So the C here, the C is connected to the other C in one hand, and the three hands are hydrogen. So CH3, so we start counting 1, 2, 3. So the third carbon atoms from this fatty acid has double bond. We don't care about the others. We care about the first double bond. When the first double bond happening on the third carbon atoms, we call this fatty acids the omega-3. And when the first double bond happening on the 6 carbon atoms, we call it omega-6. So, so that's why. Okay, so what are the examples? We know that the first one, the omega-3, the example is alpha-linolenic acid, and it's short for ALA. And the omega-6 is linoleic acid, which is short for LA. And we know also that why we call them essential. We know that they are essential. We call them essential because our body cannot synthesize them. We need to obtain them from food. Otherwise, we'll develop deficiency. So humans also have the capability to synthesize other important and essential fatty acids from these two main fatty acids. So from the alpha-linolic fatty acid, which is the ALA, we can synthesize EPA and DHA. Very famous for our health and normal growth and development, for our eyes, for our brain, may play a role in prevention of cardiac diseases, especially like coronary artery disease. Also, arachidonic acid can be synthesized from the LA, which is the linoleic acid, which is the omega-6, I'm sorry. Now, deficiencies are unlikely because we tend to have like a lot of them from the food. We have them a lot in our food. Serve as structural part of cell membranes. This is the roles of essential fatty acids. So first of all, they are very essential because each and every one cell in our body depends on the presence of these essential fatty acids for the cell membranes. Also, they serve as precursors of others longer fatty acids that can make eicosanoids. And eicosanoids are members of the lipid family that have like power compounds that they perform many functions such as localized hormones, like prostaglandins, like thromboxanes, like leukotrienes. Are you familiar with these names? Okay. So this is just to explain how they are, their activity in our body. Like for example, these products can prevent or alter the activity of platelets, contribute to blood clotting, like regulation of blood pressure, inflammation, modify the process of inflammation. We know that the omega-3 is mostly found in marine sources and also found in flax seeds and olive oil, because these are rich in omega-3. And remember when I showed you the oil usually it occurs in nature as triglycerides. Like all the oils and lipids occur in triglycerides. They never occur in free fatty acids. They become free fatty acids when they are broken down inside our body. But so when we look at the oil, we don't tell that it's only omega-3. It has like a higher percentage of omega-3, but in addition, it has also another types of fatty acids, because the glycerol is attached to 3 different fatty acids. Omega-6 also found in vegetable oils and meat. Now the dietary intake. Now this is very also important to know that usually we tend to have a lot of omega-6 in compared to omega-3. And we have, like, according to studies and reviews, they found that we should balance them. We should try to, make them in a advisable ratio that still there is the debate, but they found that the modern Western diet is usually higher in omega-6 and very low in omega-3. Usually the ratio is like 17 to 1, like 17 omega-6 to 1 omega-3. We rarely eat fish, we rarely eat seeds, we rarely eat nuts, and we take more of meat and chicken and animal fat that is high in omega-6 rather than omega-3. So how can we tell? Humans should consume more omega-3 from vegetables such as flax seeds and marine sources, especially fatty fish. So this is what I'm telling you about, like the different types of oils we have in nature. They contain different types of fatty acids. But let's see the majority. Like we need to know here that we need to focus more on those high in monounsaturated and those high in omega-3. So let's see which one is the highest in omega-3. The blue one is the flax seeds oil or flax seeds. So flax seeds اللي هي بذور الكتان أو زيت بذور الكتان. فهلا بذور الكتان موجودة جدا، اللي هي أظن بيقولوا لها نفسها حب الرشاد. not يعني sure، بس هي اللي بيقولوا لها هيك. كمان نفس الشيء السالمون فات. يعني you can see that salmon fat also, so we can tell that omega-3 is high in seeds such as flax seeds and also high in marine sources, especially salmon. So eating salmon like once or twice a week is good. And also we have the monounsaturated fat, which is good also. It has good, you don't eat, huh? You don't like us, okay. You can have like flat seeds, you can have nuts. Yani there are always like a little bit of here of some of them, in some oils. You can also take omega-3 supplementation. It has yani good implication on health. The safflower and this is the monounsaturated, the olive oil. The olive oil has the highest percentage of monounsaturated fatty acid, which has also good health implications. So this is just for you to to review and know. But you can see here, like, oh, yeah, I forgot to mention that I told you that saturated fat is mainly in animal products, but also we have exception because some of the plant, such as coconut and palm and cocoa butter, have high amount of saturated fat in them, even though they are like plant sources. So that's why we need to be careful with this when we consume a lot of a lot of them, because they tend to have a lot of saturated fats. Now we'll go back to the ratio. We have, as I mentioned, that it tends to be oversupplied, the omega-3 over omega-3, omega-6 over omega-3. And the problem, why do we care? Why do we need to have like a balance? Because omega-6 is known to have a pro-inflammatory or hyperimmune response in the body. So this is the problem with the omega-6. When we eat a lot of omega-6, that means that we are like making a lot of inflammation and hyperimmune response, and this will interfere with the also proper function of omega-3, which has the opposite function. And this will cause chronic cardiovascular disease and inflammation or inflammatory responses. Now let's look at this table here. A comparison between omega-3 and omega-6 in terms of the chronic diseases, such as the cardiovascular diseases and the inflammatory responses. We can see that omega-3 usually lowers all these cardiovascular diseases, such as arrhythmia, thrombosis, atherosclerosis, plaque, LDL, triglycerides. So all of them will be increased with omega-6, but the only thing that will be decreased is omega-3 will increase the HDL. So omega-3 here lowers this all these problems and increases HDL, while the omega-6 will increases all these problems and decreases the HDL. And also the inflammatory response is the same. So it's better to be wise always and be careful and make sure that you are balancing between them. So how can we tell what is the best balance? As I told you, it's still a debate, but according to epidemiology and dietary intervention studies that concluded that while an exceptionally high omega-3 ratio promotes the development of many chronic diseases, high omega-6 to omega-3, a reduced omega-6 to omega-3 ratio can prevent or reverse these diseases. So we have some examples, like a ratio of 4:1 was associated with 70% reduction in mortality in secondary coronary heart disease prevention. So because the ratio here is very little, like 4:1, compared to the Western diet, which is 17 or 15:1. We're talking about, of course, the higher is omega-6 and omega-3. Yes. Sorry, 4, no. 4 is omega-6. Yeah, it's okay. It's okay. We need to have, like, we cannot omit omega-6 from our diet. It has also a very beneficial function, as you may know. Like omega-6 has also production to other essential amino acid, fatty acids. We need to always, provide to our body both, because they are both essential. But the problem is that we are oversupplying omega-6 than omega-3, so the ratio is becoming very big. The difference is becoming very big. So we are giving like 16 times or 17 times omega-6 and 1 time omega-3. Now we need to give like at least 4 times omega-6 and 1 time omega. That's what we mean. This is one example. And another example, a ratio of 2.5 to 1 reduced rectal cell proliferation in patients with colorectal cancer. So it can also protect against cancer. And also in women, when we had like a lower ratio in women, it was associated with decreased risk of breast cancer, and a ratio of 2:1, 3:1 suppressed inflammation in patients with rheumatoid arthritis, and the ratio of 5:1 had beneficial effects on patients with asthma. So what is the best ratio? They agreed that a ratio of 10:1 has يعني whereas a ratio of 10 to 1 had adverse consequences. So anything below 10 is advised, you know, like try to make it as low as, you know, 9, not higher than 9, because 10 to 1 has an adverse effect. Okay, so whenever I ask this question in the exam, they don't know how to answer it. So please, yani, if you have any question now, if it's not clear, just tell me. Now, hydrogenation, you know that hydrogenation is the addition of hydrogen atoms to the double bond. Why? They want to make it solid, because whenever it is saturated, it's solid. Why they make it solid? Because in commercial, just to make like more residue, they will not use butter, real butter in the recipe. Like they're making in the factory, they make like cookies, they make any type of you know, sweets that have in the recipe butter. So what they do, they bring the very cheap oils that are liquids, and they hydrogenate these oils, and they make it as butter, but it's like artificial butter, or it's called like plant butter, and they put it in the recipe to make it, you know, taste like butter. And then what they do, when they do this, they found that the fat will not be fully hydrogenated. So some of the fat will stay having double bonds, but the structure will be flipped. Like instead of having the methyl group on the same side, the methyl group will be altered, one on the side and one on the side, and that's why they call it trans fatty acids. I'm sure you've heard about this trans fatty acids. So this is the, you know, very basic introduction to or explanation how it happens. So during the hydrogenation, some of them will escape the hydrogenation, but they flip or they trans the methyl group, and it is found in the chemically hydrogenated margarines, commercial frying fats, baked goods, salty snacks. Sometimes it happens also during like heat, like when we use the oil many times, like when we order French fries from restaurants that haven't changed their oil for months or maybe more, and these oils are, you know, boiling all the time, and they are like changing the structures of them. So we are eating these trans fatty acids. So they have negative effects on human health. Of course, alhamdulillah, even in the Kingdom of Saudi Arabia, they banned the trans fats in our food products. But of course, sometimes they can be found in, actually they are found, trans fatty acids are found naturally in dairy, but in very small amounts. And as I told you, like during, you know, production and during heating and during, you know, cooking, sometimes we can get some. So high intake, what is the implication of trans fatty acids? The high intake of trans fatty acids is associated with increased risk of coronary heart disease, cancer, and other chronic diseases, including diabetes. Now, what are the roles of triglycerides in our body? We know that triglycerides is found in the adipose tissues, okay? So the adipose tissues is mainly under the skin. So they preserve our energy, and they made like cushioning, and they made also isolation, and they help the body use the carbohydrate and the protein efficiently, like, you know, because we have a reserve of fat and or like energy stores. If we need the protein for its own function, we use the protein, and the same is true for carbohydrates. Now, high consumption of energy and sugars, especially alcohol, is associated with high blood triglyceride level. I'm not sure if you're aware that triglycerides in the blood, those who are at the back, is the high consumption of sugar associated with high triglycerides level? Yes, why? Why? When we eat, like when we consume a lot of sugar, when we consume a lot of sugar, the sugar will be converted into triglycerides for adipose tissue, right? Because we cannot store glycogen. a lot. We can store a little bit, but the rest of the high sugar intake and high carbohydrate intake. So we'll go back to rice consumption, we go back to bread consumption, we go back to all the carbohydrate consumption. That's why we need to limit, if it's not, you know, used as a source of energy, if we're not very active, if we're not athletics, if we're not running or doing and, you know, like using all this energy we're consuming, it will be converted into triglycerides. And these triglycerides will be deposited on our organs, like liver, fatty liver, and other organs, intestines and heart and all the organs. So therefore, there are a risk of heart disease, maybe sign of metabolic syndrome, because of the belly fat also, because of the visceral fat found in our body. Now, phospholipid is the second classification of fat. Phospholipid is the compound similar to triglycerides, but it has a difference in the phosphate group, having a phosphate group and choline in place of one of the fatty acids. So it's very similar, but instead of having 3 fatty acids, it has a phosphate or choline group. Now, you don't need to memorize the structure and this, but I'm just bringing this just to make you understand more. Now, the importance of phospholipids is also very important in the cell membrane, allows fat-soluble substances move back and forth across the cell membrane into a watery fluid on both sides. Let's make attendance. Can you help me making attendance? Yeah. So to go back to the phospholipids, we know that also it is very important constituents of the cell membranes, and it has like a special characteristics that allow the soluble and the fat soluble substances move back and forth across the cell membrane because of the because of the nature of the fat. And especially when it's in the watery fluids on both sides. Also, it acts as an emulsifier. So the emulsifiers means the mustahlab. That helps in keeping the fat suspended in the blood, because the fat is different medium and different solubility, than it doesn't dissolve in water. So it helps in emulsify the fat that is suspended in the blood and body fluids, such as lecithin. Lecithin is a major phospholipid. It's very famous. It's found in the eggs, and it also can be made by the body. The major components of all the lipid molecules that carries the fat in the blood, such as the LDL, HDL, all the lipoproteins. And as I said, it's found in the eggs, and especially the egg yolk, mainly egg yolk, because the egg yolk has the fat, the egg white has only the protein. Plant sources are soybean, peanuts, legumes, and spinach are also good sources of phospholipid. Okay. Now the last one in the fat is the sterols. Sterols is the ring, multiple ring structures. So it's not only one structure of ring structure, it's multiple, and it's found in both. It's found in plants and found in animal. Now the phytosterols is the plant source of sterols, and it's natural. It's found in plants. It's found to have like beneficial effects on our blood cholesterol level, and also on our health, like heart diseases and stroke. They may also, like sterols, plant sterols may prevent obesity, diabetes, and cancer. Why? Because they are mainly found in vegetable sources. Now, this is another reason why we should aim at including our, in our diet, fruits and vegetables, also whole grains, nuts. So other names of phytosterols are plant stanols or sterols or stanol esters. So all of this, if you read them, you know that it's the same. Now, what we need to know about sterols are the cholesterol. It's the most famous sterol, and it's, of course, coming from the animal source. It is the basis for all the steroid derivatives made in our body, such as the hormones, like glucocorticosteroids, mineralocorticosteroids, androgens, estrogens, bile acids, vitamin D. So all of them are made basically from cholesterol. And it has only like animal sources that contain significant amount of cholesterol. So we rely on our cholesterol from the animal sources, but also our body can make cholesterol in the liver. It's also found in all cell membranes, and as I said, it can be synthesized. High LDL cholesterol is associated with high risk of heart disease and heart attack. But does this mean that if we eat cholesterol, we'll raise our LDL cholesterol? Not significant. Why? Good for you. Cholesterol is cholesterol. It has, cholesterol in general. When we eat cholesterol, we are not providing or contributing to any differences in the ratio of LDL and HDL. What they found is if you eat a lot of cholesterol, more than we need, we may raise the total cholesterol, but we will not affect our ratio from LDL and HDL. The main issue we need to prevent cardiac diseases and coronary heart disease is to lower the LDL and raise the HDL. And that happens by eating like healthy food, and as we're going to see here, because we know that high HDL will have a protective effect on heart and muscles and heart and okay, so this is I will go back later. This is the health effects of lipids. So the high intake of saturated fat will raise the LDL cholesterol. So when we eat saturated fat, when we eat trans fat, we will raise the LDL. But what we don't raise LDL level by eating eggs. So that's why we always tell the patients, even if he's having cholesterol, we tell him you can eat eggs like once every other day, like 3 times a week. It's okay to eat the yolk and the white and everything. If you want to eat more, you can add only the white, to the next egg. And also high trans fatty acids and high LDL will and low HDL will lead to unfortunately will be like a good recipe for heart disease. Now we'll go back to the synthetic lipids. Synthetic lipids means that the fat replacers, first of all, fat replacers, and then we have the medium chain triglycerides. The fat replacers means that they imitate the texture and the flavor and the sensation of fat, but it doesn't have fat, or maybe like they do not provide readily absorbable nutrients. They can pass through the GI tract. And this is actually used in the fat-free products. When we eat something that has fat-free, like cheese, fat-free, and we see it melt and we taste it as fatty and we see some oil coming out of it, but actually it's just fat replacer. It's not. And it's very famous commercially under the name of Olestra. Now, the medium chain triglycerides is another synthetic lipid that can be found sometimes in nature, but also it's found commercially contain 6 to 12 carbon atoms. It provides a little bit less calories, like 8.25 compared to 9. So it's just a little bit less. It's naturally occurring in coconut oil. MCT increased energy expenditure may result in faster satiety. We use it actually in our hospital as it comes in bottles like water. It looks like water. It just, it doesn't have any color. I didn't taste it. Maybe it has a taste, a flavor, but it's used mainly in chylothorax. Do you know what's chylothorax? It is the leakage of the fluids from the lymphatic fluids. When they do like operation, like cardiac surgery or any surgery involves the thoracic area or the pleural cavity, so they sometimes the leakage happens from the lymphatic fluids, and then the chyle will accumulate, and then when they do, they accumulate a lot. So usually the main management for this is to put the patient on fat-free diet basically, no zero fat in his diet or feeding if he's on enteral feeding. So what we do is we do this because this will significantly decrease the chyle accumulation and improve the symptoms until the leak is resolved. So what we do is we give them the medium chain triglycerides, because medium chain triglycerides it doesn't have the same metabolic pathway as the other fat, so it will not go into the lymph. Now for the recommendation, as you can see also, the recommended dietary guidelines is having fat between 20 to 35%. And less than 10% should come from saturated fat. Most fat should come from monounsaturated and polyunsaturated. Trans fat intake should be kept as low as possible. Try to eliminate it altogether. Limit the invisible fat, limiting the invisible fat that marbled the meat, hidden in cheese, chocolate, baked goods, all these foods that are high in fat usually, and especially the fried foods. Now this is just for you to understand how the best fat is available where and the worst fat is available where, and this is for your reference. Now we'll move to the last macronutrient, which is the protein. For the protein, as you may all know, that the basic or the building block of protein is amino acids, and the protein has a major like 20 different amino acids that are attached together. Now amino acids have the same basic structure of carbohydrates, but having like amino group in addition. 1 gram of protein is similar to 1 gram of carbohydrate. It's very similar. Roughly they estimated the same, 4 calories. A very, very small difference, but we always refer to as 4 calories. The classification, of course, depends on the essential or non-essential or conditionally essential. For the essential, we mean that essential that because of our body needs these essential amino acids. Without them, we will not be able to synthesize the non-essential and other amino acids, and some of them will become conditionally essential in times of diseases, illnesses, and pregnancy, and so on. So just to go through proteins very quickly, we know that proteins serve as building blocks or building material for a lot of function in our body. So basically, we don't rely on protein for energy, although it provides us with energy, but we don't rely on protein for energy because it has a very, more important roles in our body. So for the growth and maintenance, who can give me an example for protein who can help in growth and maintenance? Okay, collagen, enzymes, any enzyme in our body, like digestive enzymes, hormones, growth hormones, or insulin, regulators of blood or fluids, fluid balance. We're talking about the protein. Albumin, yes. Acid-base regulators, like buffers, transporters, like hemoglobin or any transporters, like antibodies, like immunoglobulin, sources of energy and glucose. This is the last role that we can synthesize glucose in a reaction called gluconeogenesis to synthesize glucose if we don't have enough glucose, and also it can contribute to source of energy when it is needed. Now we have something called nitrogen balance. Of course, this is not included that you need to know the equation, but we should know that in healthy adults, protein synthesis and degradation are always balanced. Like the amount of protein we consume and the amount of protein we secrete with all the urine, feces, and sweat are always the same. So we always have something called zero nitrogen balance, but sometimes in times of illness, we develop negative nitrogen balance. And this means that we are losing our muscles, we are losing protein. And that's because of the higher demand for protein, because protein involves in a very important function in our body. And when we develop positive nitrogen balance, this is mainly during pregnancy when the child is growing, and pregnancy and also the growing child. Now we have protein in the foods, but which of them are healthy and which of them are like having good quality protein? We have the good quality protein. That means that we have this protein have the same or the main essential amino acids that are needed for our growth. So this is called complete. Why? Because it contains all the essential amino acids. And the example for that is the animal protein. So having any animal protein is considered essential or complete protein because having all the essential amino acids. And sometimes the quality of protein also is important, and it's measured by the bioavailability, which means that is it digestible, most of it, because sometimes protein is not 100% digestible, and it will not supply or support growth and development for the growing body. Now the complementary protein is having the food that have 2 or more dietary proteins that have like some of the essential amino acids here and some of the essential amino acids there, and when we combine them we get complementary protein. So examples are the plant sources of protein. Now what are the recommended intake? You can see that from the first 2 macronutrients we refer to the recommendation by percentage, like by having 30, by having 45, by having so and so. But for the protein, because it has essential role in our body, we tend to make sure that we are getting enough protein that we need, and we tend to measure the requirements by grams per kg, per healthy weight, like ideal body weight or adjusted body weight. So 0.8 grams of protein per kg per day is the minimum requirements for our body. Okay, so this is called the minimum requirements. And if we want to just like estimate how much is in percentage, we can say it between 10 to 35. But this differs because some people are having like 2,000, some people are having 5,000, some people are having 1,000. So we cannot just rely on the percentage. Better to always calculate the protein. Now, as you may know, protein is found in a lot of sources like animal and plant sources. What are the health effects of protein? Overconsumption offers no benefit and may pose health risk. So I know that you need to know about the protein intake. I'm going to give you a detailed lecture in sports nutrition about the protein requirements, but believe me, there is no need to have a high protein intake as long as you don't need it. Like some conditions, if there is someone who is ill, have burns, have like certain stress, disease, infection, then we need to give more protein. And we should know that some high consumption of protein will yield to having health problems and health conditions such as heart disease, because usually the animal protein or animal sources of protein is high in fat as well. And when we consume the saturated fat, we are contributing more to the LDL cholesterol. And also elevated levels of amino acid homocysteine will be also like it can cause elevated level of amino acids and causing heart disease. And sometimes when we have like arginine is known to have a protective against heart disease, so lower the homocysteine level. So this is like mainly for the patients, not for the just like the normal population. Cancer population studies suggest correlation between high intake of animal protein and some types of cancer, colon, breast, kidneys, pancreas, and prostate. Why? Because these patients usually, or these people usually don't have a lot of fiber in their food, and they usually don't have, healthy food. So they rely mostly on protein only, and animal protein only, and they have like a high fat also in their diet. Osteoporosis, we know that protein, if it's high intake, this will increase the calcium excretion, and this will contribute to osteoporosis. Weight control, of course, having protein-rich foods are often fat-rich foods, so you will be facing a high energy intake. Like as we said, each gram of fat will yield 9 calories. So imagine having like greasy meat or chicken or like fried food. So this will contribute to weight gain. Kidney disease, of course, for those who are at risk, have kidney impairment, they have a risk to develop to progress their kidney disease if they have more than they should from protein. Now, very, very quickly, I will just review the basic food groups with you. I'm sorry I took a lot of time, but it's very big and large lecture today. So I'm sure you know that food groups are divided into groups, like our food into food groups, like vegetables is a group, fruits is a group, grains is a group. Why? Because they are similar. They are similar in the properties. They are similar in the nutrients they have, in the content they have. So this is mainly the food groups we have, which are the 6 food groups, and they are main food groups. And of course, each group has a wide variety of foods and choices underneath these groups. So we need to eat from all the food groups in our diet. But of course, the contribution of each group will be depending on our needs. So so for the United States Department of Agriculture, they made the My Pyramid, which is not only focusing on the amount of or the groups that we are taking, or how many servings from each group, but also they are focusing, as you can see, on the movement and on the daily activity. So they explained like the groups. They made it like a horizontal, not horizontal, longitudinal, and they specified each group or each food group what are the best to choose from. Based, of course, on your energy requirements. You can type on this USDA and or My Pyramid, and you can individualize your requirements by just doing that. But now they brought something else, or they came up with something else, which is called the My Plate. And My Plate is very easy to understand, rather than look at the pyramid and looking at the plate and imagining that how we should contribute or distribute the different food groups into our daily meals. But if you can see that My Plate doesn't have any specified specification of like the grains, is it whole grain, or the protein, what kind of protein, the dairy, is it low fat, they're not focusing on details here. So the School of Public Health in Harvard, they published the Healthy Eating Plate, which is a modified version of My Plate. So this is mainly the best guide for us now, to tell our patients to use this guide to choose their daily meals, focusing more on vegetables than fruits, because vegetables are less in sugar, fruits are higher in sugar, focusing on whole grains rather than having simple or refined grains, focusing on healthy proteins, and everything is explained on the sides. Also adding healthy oil. My Plate doesn't have any oil in it. Here is, if you can see that instead of dairy, because none of the, or not all the people need to have dairy every day or every meal. So maybe like we are over recommending the dairy. So maybe we drink water, tea, coffee without sugar, and limit milk and dairy to 1 to 2 servings, depend of course on the requirements. Of course, this is for the adults. We have also the children My Plate. And for this, actually, I don't recommend you to go for this, because I added some slides, so maybe there is okay, I didn't specify, I removed it. Okay, so just for your reference, if you need to read more, and that's it. We made it on time, alhamdulillah.